Hi, my name is Darren and welcome to this short series of mini lectures on the anatomy of the thorax. In this first video we are going to be looking at the surface anatomy of the thorax and landmarks. The ILOs for this video are to be able to identify the important bony landmarks of the chest and to be able to relate these landmarks to auscultation sites for the lung and heart. Here I have drawn an illustration of the male chest, and it should be noted that the chest is said to extend from the clavicles above to the inferior costal margin below. Here we have the clavicles and the suprasternal notch, which is also sometimes referred to as the jugular notch, which can be felt on palpation. We can draw an imaginary line down the centre of the illustration, and this is the midline or mid-sternal line. There's another line that we can draw down the illustration halfway through the clavicular body, and this is known as the mid-clavicular line. Also visible on this illustration is another line which is referred to as the anterior axillary line. Between the clavicular heads you have your jugular notch, and you can palpate your way downwards to feel for the sternal angle or the angle of Louis, which feels like a bony lump, and it's a particularly useful landmark in that if you move your fingers laterally to it, they will fall into the second intercostal space. The sternal angle is referred to as the angle of Louis after the French surgeon and physiologist Antoine Louis, and this surgeon designed a prototype for the guillotine in the 1700s. In the final part of this introductory video, we are going to look at auscultation of the lung and the heart. Also, please try to ignore that I hadn't drew the blade on the guillotine before, because it obviously wouldn't be very useful without it. So to start, we're going to look at lung auscultation, and we're going to look at this anteriorly only. When referring to the lungs in an examination, we typically refer to them as upper, middle and lower zones of the lung, because you can't be entirely sure where you're working with below. We can listen to the apex of the lung in the supraclavicular fossa. We can listen to the upper zone in the second intercostal space in the midclavicular line. We can listen to the middle zone in the fourth intercostal space in the midclavicular line. And we can listen to the lower zone more laterally. So this is in the mid-axillary line. And finally, we're going to look at cardiac auscultation. So a useful mnemonic is all prostitutes take money. And this is whereby the A stands for the aortic area, and this is in the second intercostal space to the right of the sternum. The pulmonary area, which is the second intercostal space to the left of the sternum. The tricuspid area, which is the fourth intercostal space to the left of the sternum. And the mitral area, which is the fifth intercostal space along the midclavicular line.